Thanks for staying with us. So there has been quite a bit of outrage as Nigerian Nurses Council demand 2-year experience for overseas practice. According to reports, Nigerian nurses are protesting the new rules to prevent them from working abroad for 2 years after completing their training. The rule imposed by authorities trying to stop the exodus of medical talent being mirrored across the continent. Our applicants are now required by the council to have at least 2 years post-qualification experience from the date of issuance of their permanent practicing license. Now, later on the show, we're having a UK licensed and practicing professional mental health nurse clinician very soon. But before we come to him, let me come to the ladies, because this is a major issue that we've been facing, the exodus of Nigerians, not just nurses, doctors, digital experts, IT experts. It's just been overwhelming for even government. But now nurses, the Nursing Council is saying, before you even go anywhere at all, you must wait 2 years. Do you think it's a good or bad thing?
I think it's a good thing. Anything to keep the expertise within. So they learned here. They should serve here at least, just as if you're doing your pre-call to bar, your law school service. You also earn your skills here. So they shouldn't see it as an entirely bad thing. They get better with experience. And so wherever they go, the knowledge is still theirs. What we are only trying to do, the only benefit that accrues to us is that we give the knowledge, gets the personnel available, but they will be gaining more and gaining more experience. It's a win-win.
Why do you think people are resisting? Why do you think nurses are resisting? Why do you think they are resisting this?
Well, I think from time past, before people even started this, before the Japa syndrome started, nurses and doctors have been one group of people that have always left Nigeria. And the reason that they are resisting now is because this is something that most children, most parents even encourage their kids to study nursing just simply to leave the country, not even because they want them to practice in Nigeria. It's just seen as an avenue to leave Nigeria. So,
connecting that to what Nima has said earlier. So it's like we're sabotaging ourselves. I'm not training my kids to help Nigeria, to build Nigeria. I'm training them to go abroad to live better lives.
For themselves.
So it's like we're also using our educational system to sabotage ourselves.
Yes. So you're right. You know, a lot of people who study nursing, especially here in Nigeria, it's really, I'm not saying that there are those who don't study just to practice it, but we know. And we have friends, we know family members, we just have people that, you know, they've been told the easiest way to get there, or when you get there, if you have a nursing certificate, it's easier for you to get a job quickly. These are a group of people that they are constantly looking for. And you're right, it has never been a problem because you just knew that this was a way to go, another avenue to go abroad. And now they are protesting it because it's, you know, when something has become, it's so normal that you think it's your right.
Yes.
You know, so that's the problem now. It's, why are you stopping us? I've done what I'm meant to do. I have studied. I'm supposed to just go. Why would you put these 2 years on me? And for me, it will be an appeal to them, which is, there's a huge problem on our hands. This is not Nigeria of 20 years ago. This is the new Nigeria where many of you are leaving, and we are, you know, there's a shortage in our country. There's nothing wrong with giving 2 years, in my opinion, just giving 2 years to your country and then go ahead and, you know, find other opportunities.
Right.
I think,
sorry, can I respond to that? Yes, you give 2 years to your country, but what is your country going to give to you in that 2 years?
your country gave you first.
Okay, so...
Your country gave you first, cheaper education.
Definitely.
So now the Nigerians in the UK who are working in Naira and paying in the pounds are not finding it funny.
Okay.
If government takes out whatever they subsidize, as they have left the Naira to float now, you see the real value of what you get. Also, the quality of education you get here, whether you like it or not, whether they tell you so or not, is good. That's why you can sit for an exam internationally and pass it. I have a cousin who sent a letter to my side of the family recently asking for sponsorship in school. And we're discussing, and she wants to be a nurse. And why does she want to be a nurse? It's because she thinks that, you know, with this is the fastest way out of the country.
Yeah.
How much is the value of nursing? She wants to go to Unilori for education. How much is the value? She said 100 plus. So imagine that, compare it to what you might have to pay when you go out there. So your country is giving you first, but Nigerians don't ever think Nigeria gives us.
I understand that.
Doesn't give
So that's the problem. See, when you said that during the paper review, it really sunk in because we always point fingers. And I've always said on this table, we're always so easy to point fingers. Government did this, government, forgetting that we are also part of the problem. We are equal. As much as the selfish part of me says, I can't raise my children to go to school here, and then you pay them 100,000 naira at the end of the month. You have spent so much in nursing. So there's also that part of me. But also, are we also thinking of Nigeria? Because now the nurses want to travel abroad. Who's going to treat you? God forbid your loved one is sick. We need a nurse.
Yeah, so they've always traveled abroad, you know. The problem is why give them this 2 years guideline. I think, with nurses, with traveling, you know, or schooling here, some people will argue that you gave us the tuition to pay. We paid it. So it wasn't as if we had asked for, some of them went to private universities, you know, so it's not as if they asked for subsidized rates. That if they would say if you had given us more, we would have paid it. So we have played our part. According to them, we have played our part. We have done what we're meant to do. Every other person goes to university, do what they have to do, get their certifications and leave. Why are you, you know, targeting us? So that's why I will not come, this conversation, I will not come from the point of, we have done so much for you. What have you done for us? They have. And, you know, one thing also with nursing is that while you're in nursing school, you're also already in hospitals giving, yes, you're learning and you're also giving of your services. But then allow us the opportunity to seek greener pastures. Allow us the opportunities to grow and, you know, earn more money. After all, some of them will say, we're even coming back. Gain more experience, we come back. But for me, this conversation is really about where we are today. Because of the situation we have today, it's everyone that we're calling back to look closer, you know, to look at home better and do better for our country. We cannot use things that were okay in 20 years, you know, 20 years before, is not okay today. Many of us have put our children through schools because we want them to go abroad and, you know, find a better life. So we cannot say the nurses, especially, you have subsidized rate. That is what happens in Nigeria. And we hope that because it's that way, we can also attract people to come to our country to read nursing or medicine if it's cheap, if it's that beneficial, that is the fact that it's cheaper is more beneficial, then they can come to our country and also, you know, we can earn exchange rates from that. So this is really about where we are today and not just...
So I totally agree with you that we are here, we are where we are today, but a lot of our youth are not seeing it. Nobody is selfless again. They say, a very selfish world, you know? And we got here just by a trend. It's better out there, it's greener out there. That's just by that. Nobody wants better for their fellow Nigerian. So, can I come and kill myself? I cannot come and kill. It's a slogan. So, once I graduate, I go, I make whatever pounds I make. And, you know, if you make the pounds and spend the pound in pound country, you're not exactly rich. It is when you make the pound and spend it in naira that you can pepper them back home and say you have earned higher. The inflation is global. It's everywhere. But it's only here that everybody is on the street and we are all shouting.
Where are they going?
Yes. So, earn the pound and stay in the pound country, or even pay your education in the pound country. No. Nigerians would take the education cheaply, especially for medical schools, nurses and doctors. We know we have a very higher subsidized level here. When you do law and you go to the UK, you will take their exams to qualify. You will pay.
Yes.
You will take exams per state in the US to qualify to practice. So nobody is dashing you anything.
And if you try to even pay the extra money here, they'll carry placard.
Yes.
Want to increase school fees.
So you cannot. And we don't do student loans here, exactly. So what are we talking about?
I think what needs to be done now, instead of, you know, enforcing this 2-year stay on the nurses or the people in the medical industry, what you should try to do is to make their welfare system so good that they don't even feel the need to leave. If you are giving them, give them good, welfare system. You're supporting them. You're giving them education, travel, study grants where they can go and even learn in other countries and come back. Then there's no point. There will be no need to enforce that 2-year stay if things are good. So that's the point I'm trying to make. They will be ready to give back to their country in every way possible if the country is able to support them and provide
also
for them.
have to add that man is naturally selfish, because I'm even hearing that more Nigerians are coming to Nigeria for medical tourism. Because, for example, the dental care, you want to get your tooth done abroad, they're asking you thousands of dollars. You come to Nigeria and they'll pay, you have been less than, you do it. So they are sneaking it. They will not allow it on social media that they came to Nigeria for dental. They'll just keep it quiet. We just came to Nigeria very quickly. All this, you need to see a cardiologist. Sometimes they come to Nigeria for that. Because these are expensive things. You come to IVF, it's cheaper.
Okay, so that's
so
they are
do IVF here.
Exactly.
So you now see where the nurses are coming from. Where we're going, where they are going abroad, they're giving them something. There's a reason they're leaving. They're leaving because better pay or maybe better conditions of work, Then there's something that we should have as well that they can come for. If our education is really better and we know that it is cheaper, then it should be able to attract international students, one. Then if our services that we provide is cheaper, and we already see that it's attracting people, then let's also work on the things here in our country to attract people so that it's a fair back and forth. Because whether we like it or not, human beings will be selfish and they will chase, things that will make them improve, either financially or, otherwise. So Nigeria cannot keep, what I'm trying to say is that Nigeria will keep fighting this war of be patriotic, don't be patriotic. Now let us find a way to also monetize what we have, to attract foreign investment or foreign investment into our country.
I totally agree with you and also on this one that, we can do better. We can create a better motivation for people to stay and people to work here.
And people to
But
come.
it's not for the failure of doing that we are here where we are. It's just the start, as far as I'm concerned, a trend started. I cannot keep myself, there are better work and pay there. And when the stories come of the hardship, of the number of hours medical workers put in abroad, we say, no, let me first of all go. Let me go and join them. Let me
bring in our guests.
Just that trend.
To share some light.
To see another side.
Join us to join the conversation is a UK licensed and practicing professional mental health nurse, clinician, multi-award winning healthcare innovator. He is a health advocate, Josiah Okeshola. Welcome to the show, sir.
Thank you, everyone, for having me on the show.
So I know you've been hearing our conversation. What are your thoughts on this 2 years that the Nursing Council is imposing on our nurses?
Thank you, Mariah. I must say, having this conversation is really sad, right? The country is down. People's morale is down. Now, let me focus on nurses. Before now, nurses have been suffering in silence, right? We're not saying the government should not do its duty of, putting laws in place, putting guidelines in place. Those things are okay. The Nursing Council is there to regulate nursing profession. That is fine. But we are ignoring some things going on behind the scene. We're just looking at the surface. Now, let's look at the way nursing profession has been run in Nigeria for the past 20 years. Everyone is worried that at this time, this kind of policy, the content of the policy is inhumane when you compare what nurses have been going through. Now, let me tell you, I had a conversation with Aaron. No, in the last 20 years, there has not been any single investment in the nursing profession by the federal government. I have facts. I practiced in Nigeria for 20 years. Nurses go to school, right? Nurses pay their own school fees. The average fee that a nurse pays in Nigeria for school fees is between 150,000, 200,000, 200,000, and they pay this money all through the years. This has been going on for the past 10, 20 years. Nurses pay their school fees through no single scholarship in Nigeria to supplement the education of nurses. So parents of nurses sweat, sell pepper in the sun, borrow money from a cooperative to send their children to school. Not to go abroad, right? But to practice the nursing profession and care for people. That is the genuine interest of every parent, every young people who come to the profession. They come out of love, out of passion for the profession. Now, the government doesn't pay for uniform that you wear in school. The government doesn't give you money stipend when you are in school. The government doesn't give scholarship. The training of nurses, Mariah, is not the best in the country. It's one of the worst in the country, in the world. Oh. Why did I say that? Nurses training is supposed to be at the university level. Nursing school is supposed to be attached to the Ministry of Education, not Ministry of Health. Now, why is nursing school attached to the Ministry of Health? Because the Ministry of Health for the past 20 years have been making the nursing profession. Do you know that the nursing profession has been generating about 2 to 5 billion naira every year in the last 10 years for the Ministry of Health and the federal government? Yet, the question is, out of all this investment, how much have been invested in the nursing profession? Now, that is the bulk of the issue. Nurses have been suffering up to this moment. The average salary of a Nigerian nurse is between £50. In fact, in private hospital, you see nurses earning as low as 25,000 naira.
Yes.
In government hospital, you see nurses earning £50. £50 for a nurse. There's no money in the pocket of nurses as to speak. Nurses are hungry, nurses are frustrated, nurses are down, mentally depressed. Now, the NMC is now saying you should stay 2 years as a young nurse. Stay in the country hungry, unemployed. If you put applications out there and ask nurses to apply, you are amazed and shocked at the numbers of unemployed nurses in the country, because the nurses the government has laid embargo on employment. Now, the question is,
all right, let me put you on it. Mr. Okeshala, let me put you on a short break. Let me go on a short break, because we have to take a commercial break. When we come back, we continue with you. Stay with us. We'll be right back. Thanks for staying with us. We still have our guest, Mr. Hosea Okeshala. You were saying before the break about the issues the nursing council is having. I'd like you to continue what you were saying.
Now, Royal, in the last 20 years, what has been done to prevent nurses from leaving? I take you back to 2001, the Abuja Declaration. The African Union member states came together, all heads of state agreed that the health care in Africa is dwindling and they needed to save it. So the agreement was that at least 15% of budgetary allocation should be given to healthcare. Now, over the last 20 years, Nigeria has not even attempted to give 5%, 6%, 10%. The healthcare sector has been underfunded and been denied of funding, and that has affected the nursing profession. Now, you're asking nurses to stay 2 years. Nurses spend 3 to 5 years in school. Do internship, go to internship for another 1 year. Some of them go to NYSC for another 1 year. That's about 7 years. Staying, serving their country. Now, they come to practice and there's nothing to work with. The salary is terrible. The working conditions is inhuman. And nurses have been doing this for the past 20 years. They've been trying, hoping that the government is going to change this.
Mr. Okeshala, Mr. Okeshala, let me get a few questions in for you, because there's nothing you're saying that the average Nigerian doesn't understand. If you go to the educational sector, the same thing. Doctors are complaining. Various engineers are complaining. Every sector is going through the same issues: lack of government funding, lack of allocation, lack of investment. So, and somehow, whatever happens, we also somehow survive these trends, although we want it to be better. But in the issue at hand is that you and I, you live abroad. Those of us here now, we're at risk of not having a nurse because all our nurses are going abroad. So the council is saying, stay back 2 years. So just in case Mariah is sick, she has a nurse in the hospital to take care of her, at least for 2 years, before somebody else goes. Are you now saying that lady, the nurse shouldn't stay back to take care of the woman in Nigeria who needs care? Are you there, Mr. Okeshala?
Yeah. So the staying back is the solution. 2 years is the solution. That's not the solution. It's like using the wrong medicine for the wrong diagnosis. Staying back 2 years is not the solution. By now, what you're talking about is attracting. What you're talking about is producing more nurses to replace those who are going. We have, Mariah, we have 20 solve this problem. Nurses are not responsible for the deterioration. The federal government should take responsibility and begin to provide solutions. One of the implications of this law, why nurses are in opera, is because it's going to have serious implications on the average Nigerian. The nurses are frustrated already, the nurses are hungry, the nurses are angry. Now, the nurses who you are going to produce over the next 2, 3 years, 5 years, are going to be disinterested in the profession. Nurses are going to go to other countries to seek education. Nurses are going to find other means of living. So the solution is not forcing them to stay. The solution is making the profession attractive enough for them to stay.
Okay.
That should be the content of the discussion surrounding the policies. And the reason why this policy is terrible is because this policy was made in isolation. No consultation with stakeholders. The Ministry of Health, the Minister of Health, and the Legislative Nursing Council sat together and brought out guidelines and policies. We have thousands of nurses in diaspora who are willing to come home and help solve the brain drain problem.
Okay.
They are there. The National Association of Nigerian Nurses and Midwives do not even have a say in that policy. So what we're saying is, withdraw this policy, sit down at the right table to discuss with stakeholders, and produce a policy that actually solves the problem, not complicate or
fair enough.
All right. The problem.
All right, Mr. Akeshola, let me come to Nima.
So I hear all that you have said, but you know, it's so heartbreaking to hear that there's a body that speaks with government on these issues. Whenever the body for the medical doctors are on strike, the NMA, there's a strong, fierce assertion of their rights everywhere. When it comes to the nurses, they don't assert so much. Why do you go to a sword fight with water bags?
I didn't get the question. Can you repeat that?
Why is the Nurses Association not as fierce, as strong as the NMA when they demand this, these rights that you are talking about?
Thank you for that question. And that is why I said we should not misunderstand this situation. Many people feel that nurses come into nursing because they want to travel out. Nurses are so passionate about the lives of people. Let me tell you, nurses are the most important person in the hospital because if the doctor makes a mistake, the nurse can correct it. But if the nurse makes a mistake, the patient dies instantly. If the pharmacist makes a mistake, the nurse can correct it. But if the nurse makes a mistake, so the lives of people are nurses, and nurses can be insensitive to the plight of the public. And that is what they have done over the last 20 years, refraining because they have the passion for saving life. That is the major reason why they are still in this profession. Otherwise, many of them would have left. So the reason why the leadership has not actually been fair is because if we do so, the masses will suffer. For the past 20 years, we've been thinking about the masses, but at some point, we reached a breaking point. We were at a breaking point in the last 3 years. We could no longer, nurses are coming down with committing suicide, nurses are coming down with depression. Let me give you a personal experience. The first time I came into nursing was 2005. The first day in nursing, I saw a nurse, a male nurse, who has been working for the government for 25 years. Is borrowing money to go home. I wept that day. He's borrowing money to take transport to go home. This is someone who has served the government for 25 years. So nurses have not actually gone to the extreme of what we are seeing now because they've been thinking about the people. Now, they are now saying that two serious implications. Number one, it is still about the people. If you go ahead with this policy, people will suffer because the kind of nurses we meet at the hospitals, you will not like it.
All right, Mr. Akeshola, let me pause you. Let me pause you again. Let me pause you for a second. I have a caller who's been holding for a while. Mr. Muyiwa, go ahead, please.
Hello.
Yes, you're live. Go ahead, please.
Yeah, good morning, madam.
Morning, sir.
I'm Mario and Nima in the studio. I really appreciate the first time caller on the show.
Welcome to the show.
Thank you, ma. You see, the issue of Nigerian movies, the simplest thing is this. Every professional is looking for a better way, a better way of living in his or her career. But the truth of the matter is this. I am an advocate of the government should look for a better working condition, better salary and everything. But believe this should cut across all the strata.
I'm having trouble hearing you, Mr. Muyiwa. I sincerely apologize. Mariam,
Yeah, so I was going to say that, you know, the question Nima asked, you tried to explain it, but, you know, let me give my own opinion of why I think their voice, you say, is not as fierce. There's a way we take some jobs in Nigeria. You see, teachers, the next nurses, I feel that they are the most disrespected professions in Nigeria. The nurses would say that when doctors need something, when they need like an increment in their salaries or something and they go on strike, the hospitals will still run. The nurses want, and then sometimes also they would support the doctors. But when the nurses are asking for their own rights or for an increment or anything, they are not allowed. If they go on strike, first of all, it means the shutdown of the hospitals. You see them working even though they're on strike, because they interact with these patients closely, you see them still showing up in the hospital to make sure that, you know, lives are saved while they are on strike. But they do not get the backing from other medical professionals to help, you know, for their needs to be met or for government to listen to them. There are some groups of people, and I feel Nurses Association is one of them, where we don't think that they deserve as much. We think anybody can be a nurse. It's now that people look at nursing as a one-way ticket to traveling abroad. Before, we thought it was for those who have dropped out of school and they just need something to go to. So that is where this is coming from. Now I agree with you. I know we're meant to ask you questions, but I just have so much. But what would you say? What would you...
Wait, ask the question. Okay. Let me take John. John, thanks for calling. You're live.
Good morning, Mario.
Good morning, sir.
So thank you very much. This is a crucial matter. And like Nema was trying to support government, I want to put this question to Nema. If you hold nurse behind for 2 years, is it for them to stay in their house, or you're going to provide job for them to? Because why I'm asking this question, my daughter is at a medical doctor here in Lagos. For her to get a place to do her pharmacy, she stayed for 2 years. They rejected her to even as you went to school. That simply because it's not the ability of Yoruba. It took extra 2 years before I went back to my school to get her a place at her partnership. So now, for the period years before having her then to do her partnership, are you going to count the 2 years to say with the us? Because in a situation where that can't be about overseas, as you finish, they are putting you to have that really don't allow you to start. So I'm putting so hard to understand that the government, they are not ready for it. And to pay for the school, I borrowed money for my daughter to finish. I sold my things for my daughter to finish. As I'm speaking to you now, it is now she's having a uniform for this present war. He has not done anything. And there's no job. You go outside and see doctors looking for job, work in private hospital. They are paid thousands. So in abroad, that's how is it done now? And after borrowing money, you don't know how to pay back the money. So those are my things.
I think we got on the question. I didn't hear him very well.
So even doctors waiting for housemanship do not have hospitals to work.
Yes,
that's one I know of. I'm shocked that, you know, this extends to nurses. But then again, why are we finding out? Because, you know, the Nurses Council have put this restriction, limited restriction on nurses that are graduating. Why are we just finding out? So Maria made the comparison of the teachers, and even the Teachers Association fights strongly when they fight. The nurses, I think there's a mental box they put themselves.
I disagree.
You see that battle with them and doctors in the hospital. I don't see them as fierce as they should be when negotiating with government. That's my personal opinion. They should be as assertive as possible and clear on all the things. This is not a battle between nurses and doctors. This is a battle about your profession and how you want to be treated. You should separate it. Leave the doctors, whether they fight, whenever they are fighting. But when you are fighting for the nurses' rights, fight for nurses' rights so that Nigerians are very well understanding of the things that you're advocating.
Let me get a question for our guests.
Do
you have a question? Let me do that. Do you have any questions for?
The question I have is actually for Nima, but I would, after you want to
I'm not regulating nurses.
Yes, go ahead.
So I was going to ask if, you have been quite passionate in, expressing yourself on the challenges of nurses. Could you give us maybe 3 or 5 things you think government can do better to make nursing more attractive and nurses to stay back, more attractive for nurses to stay back in Nigeria right now? What can they do right now?
So the first thing to do is to withdraw this wicked policy first. Have a stakeholders meeting. Presently, Nursing and Midwifery Council does not have a board. The federal government needs to institute a council board that comprises of not only people in Nigeria, but nurses who have traveled abroad, who understand the pains of Nigerian nurses, and who have the solution to the problem. There are other solutions to the problem apart from what the federal government is doing. So institute a Nursing and Midwifery Council board, call a meeting, call a stakeholders meeting, and look at the root cause of these problems before you now bring out guidelines or policy to solve them. That's the first thing to do. So we need to, first of all, get this policy back. No, implementation is going to be disastrous. The second thing we need to do is ask the question, why are other countries thriving in their country? Let me cite 3 countries for example. Kenya is exporting nurses. Kenya is exporting nurses. Philippines is exporting nurses. India is exporting nurses. Now, it is not just exporting nurses. Number 2, these nurses they are exporting are getting a tons of benefit when they come back to the country and invest their knowledge, their talent. So the second thing is let federal government approve colleges of nursing in universities, in colleges of nursing across the country. We have just 400 schools of nursing producing nurses for Nigeria. That is just for 20 years. How many you have 400 schools? 400 factories producing nurses for 200 million people. These are the things that are supposed to have been done, but it's not too late. Let them go back to the drawing board, address the root cause of why do we have not had enough nurses in Nigeria. We have over 6 million unskilled, unemployed. Why can't we massively produce nurses from this 6 million? So there should be a policy. The policy is not should not be stopping Nigeria. The policy should be, how do we produce more nurses for our local consumption? How do we produce more nurses for exporting to that country? Because the world needs us. Now, apart from that,
all right, let me pause you for a second. I have a caller. Mr. Okesha, let me pause you for a second. I have another caller, Mr. Lawrence. He's been holding for a while. Good morning, Mr. Lawrence.
Good morning, ma'am.
Good morning, sir. Go ahead, please.
Good morning. Good morning.
You're live. Go ahead, please.
Yes. Good morning, madam. I am the first caller, too.
Welcome to the show.
I am a short
You're listening to the TV. Don't listen to the TV. Listen to us.
Are you hearing me?
Very clearly.
Hello? I say, good morning, madam.
I can hear you. Talking to your phone and listen to your phone.
So you have a question?
Yes, a question for Nima and now
Nima is not a question. Our guest
for the guest.
Yes,
okay.
Please.
All right. So, Mr. Josiah, you say that the country has to, why are nurses leaving and all of that. The answer to that question for me is not really with the nursing profession or the lack of active association of the nurses. I think it still boils down to economic hardship and increased insecurity in the country. Because I've worked in healthcare in the UK. I've worked in the healthcare industry in the UK. I've worked closely with the healthcare professional in the US as well. And let me tell you, I can say it for a fact, this is from my own experience. The nursing profession in those countries is equally very hard. In fact, even more strenuous than here in Nigeria. Those nurses work 12-hour shifts, sometimes even more. Sometimes even they are called back into work on their off days when they are supposed to not be at work. They are called back in to come and take over shifts that they were not supposed to. it's a very, very strenuous lifestyle for nurses. So why are Nigerians, Kenyans, Indians still wanting to go and work in these countries? Is only because there's more security, not even the pay, there's the economic security there is better. They have light, they have water, transportation. They're not afraid for their lives. They're not afraid of kidnapping, ransom, and all of that. Yeah. So it's not just about the nursing profession. It's now really about the state of the nation and how the hardship in the country is making these people.
That's another angle. Yeah. So nursing across the world is also a very tedious profession across board. Very. People are living here. So now, so the issue
leaving Africa to go also could be just the exchange rate. The fact that your money would mean more when it comes back home. Now, let me come back to you. Sir, Mr. Okeshola, are you still there?
Yeah, I'm here.
So based on what Uso just said, it's not. Yeah, how do you respond to what Uso said? It's not so much about people living. Yeah, go ahead.
No, it's not about. You see, nurses are willing to stay. Make nursing attractive. Nurses are coming to the profession to save lives. They are passionate about the profession. They know what they signed up for when they came to this profession. So the issue of running away because the economy is bad for everybody. But why not make nothing attractive for nurses first? Why not start with that? Bring out a package that is irresistible and see whether nurses will not stay. We have so many nurses who are not traveling out of the country. Now let me tell you, I worked in a private sector for 10 years, 8 years. I worked in an oil and gas sector. All through my stay in that organization, I never thought about traveling. Why? Because I was earning almost $500,000 every month. What would I even think of going out? Am I mad? Because the conditions were right. The facilities are facilities that are being used overseas. The pay was far better than what is obtainable out there. The environment is conducive. Now, before I got that job, I was working in a federal hospital where I was working 35 patients in night shift when there's no power supply in darkness. There's no injection. There's no cutting wood. I bought them with my money. There are rats. Rodent invested, mosquito invested, bedbug invested hospital compared to a good environment. So, create the enabling environment.
Okay. I think your voice has been heard loud and clear. Thank you so much. I'll let you go at this point, but thank you, Mr. Okeshola, your professional mental health nurse, clinician, multi-award-winning healthcare innovator, extraordinary global leader, and mental health advocate. Thank you so much for joining the ladies of Your View today. Coming back to you, ladies, I think he was really loud and clear. The truth is that make the profession more attractive for nurses. If you do that, it will stay, because nursing profession is not easy anywhere. No. So make us stay back. And those who have even gone abroad will be happy to come home if you provide a conducive environment for them to do so.
And if we pride ourselves on giving cheap and really quality nursing education, then it should be enough to attract foreigners to come to our country and enjoy that, and we'll earn foreign exchange based on that as well.
All right, so let's go on a break. That's all we can take on this segment. When we come back, move on to our next topic. Stay with us. We'll be right back.
Stay tuned. Your View will be right back.